Case study: Diagnosing Ileus OR inflammation through Sentinel Loop Sign in a 55-year-old patient with abdominal pain and distension. Introduction. The Sentinel Loop Sign is a specific radiological sign characterized by localized dilation of a segment of the large or small bowel on an abdominal radiograph. It often serves as an important diagnostic clue, typically indicative of an ileus or inflammation such as acute pancreatitis. Patient presentation. A 55-year-old patient presented to the emergency department with severe abdominal pain, distension, nausea, and vomiting. The medical history revealed recurring episodes of gallstones. Evaluation and findings. 1. Physical examination revealed abdominal tenderness, distension, and guarding. 2. Laboratory findings included elevated serum amylase and lipase. 3. An abdominal X-ray demonstrated the Sentinel Loop Sign, characterized by a localized dilated loop of the bowel adjacent to the inflamed area, usually near the pancreas. 4. This segment of the bowel appeared as a single, isolated loop, with noticeable dilation compared to surrounding areas on the radiograph, providing a visual clue to the underlying condition. Diagnosis and treatment. 1. Diagnosis: acute pancreatitis, with gallstones as the etiological factor, approximately 40% of acute pancreatitis cases. 2. Treatment: supportive care, including IV fluids, pain management, and dietary modifications. Exam-focused facts. 1. Sentinel Loop Sign, recognized by the isolated appearance of a dilated loop of bowel on a radiograph, often near an inflamed organ. 2. Clinical presentation: abdominal pain, nausea, vomiting, distension. 3. Diagnosis: abdominal X-ray revealing the Sentinel Loop Sign. Laboratory tests: CT scan can be used for further confirmation. 4. Treatment: mainly supportive, endoscopic or surgical intervention if gallstones are causing obstruction. 5. Etiology: gallstones in around 40% of cases. Other causes may include infections, trauma, or medication. 6. Prognosis: generally favorable with treatment. Complications can arise if left untreated. 7. Historical context: named the Sentinel Loop as it acts as a warning or sentinel for underlying disease. 8. Clinical relevance: an essential diagnostic tool, especially in resource-limited settings. 9. Differential diagnosis: other causes of abdominal pain, such as bowel obstruction, perforated ulcer. Conclusion: the Sentinel Loop Sign is an invaluable diagnostic tool for clinicians to recognize underlying inflammatory conditions, particularly acute pancreatitis. Proper interpretation of this sign can lead to prompt and effective management, significantly impacting patient outcomes. Where to find more info? Radiology textbooks, emergency medicine guidelines, and academic journals on gastrointestinal disorders are rich sources of information on this topic.